Dr. Semenza, from the broader perspective of human development, what do you think the discovery of the how cells sense oxygen has fundamentally changed our understanding of life and disease?
Well, we all know that oxygen is very important, and if you don't understand that, I always say, hold your breath and I'll get back to you. But, particularly for the most common diseases, cancer and cardiovascular disease, we know that changes in oxygen play an important role in the disease process. And we've chosen to focus on these diseases to try to make a therapeutic impact by developing new drugs.
If you have to explain the biggest meaning of this discovery to the general public in one simple sentence, how would you put it?
Well, oxygen is required for life.
Of course.
Yes.
Yes. So from the public's perspective, one of the most frightening things about cancer is how well it seems to survive. So your work revealed how cells adapted to low oxygen environment. So do you think a key future strategy in cancer treatment may be block cancer cells from adapting under stress?
Yes, that's exactly right. So we know that when cancer cells adapt to low oxygen, they also adapt to surviving chemotherapy and radiation therapy, and we know that most cancer treatments are directed against cells that are near blood vessels where there's lots of oxygen, and that the low oxygen environment is not really targeted well by existing therapies. And so we are trying to target those low oxygen environments as a new approach to cancer therapy.
In the future, do you think it will be more important to directly cure tumors or to make them lose their ability to adapt and escape?
We know that cancer is very difficult to treat, and one of the keys is to use combinations of different drugs. So, for example, we know that certain drugs can allow the immune system to kill cancer cells. And one of our strategies is to take those drugs and also target the hypoxic cells. And by doing that, we make the immune system activated to a much greater degree and increases the likelihood that the patient will respond to the therapy. So combining drugs, we think, will result in better outcomes for patients.
So many young scientists today feel enormous pressure to publish quickly, so translate quickly and success quickly. But truly great discoveries often require patience over many years. So looking back on your own journey, what is the one message you most want to give to young researchers today?
With research, we do experiments. We have success, we have failure. But we always move forward, and we can't expect to have all the answers right away, but we can hope that every day we make some progress and get closer to our goals.
Sure. So, in your view, what matters most for a great scientific breakthrough? So, talent, persistence, or the courage to keep believing in an important question. So, even when the outcome is unconcerned.
Yes, all of those things are important. And of course, the other thing that's important is the resources to do the work. And so we have to have government support for our research. That's very important because we can't do any research if we don't have resources.